Good morning and welcome back to PWT Rely News with your host, Mosey Long. And sometimes when my legs just don't feel like walking much due to my creaks and pains and arthritis, I call up Fleetwood Cab Company in Bucks County, Pennsylvania at 484-899-9600 and tell him that Elizabeth from PWT Rely News sent you over because they do a marvelous job of getting you from A to B in a clean cab with courteous drivers. And yes, that all-important question, many of them accept credit cards. However, a word to the wise, you should always have a little spare cash in your wallet. You never know when one may not have that type of ability for you. And now on to emergency awareness. And we're talking about Fidelity warning people that Medicare doesn't cover everything medical. So listen up, partners. We want to focus on a blunt warning coming from Fidelity Investments, a warning aimed directly at retirees who believe Medicare will cover most of their medical needs. No, no, no. Fidelity's message is simple. Medicare is essential, but it is not enough. And failing to plan for the gaps can create a financial emergency for y'all later in life. According to Fidelity's latest analysis, retirees should expect to spend a significant amount out of pocket on health care during retirement. There it is. Even with Medicare, the biggest pressure points are prescription drugs, dental care, vision care, and long-term care. These are areas where original Medicare provides little or no coverage, and where costs can rise quickly. I can attest to that one. Fidelity research shows that a typical retired couple may need hundreds of thousands of dollars over the course of their retirement to cover medical expenses. That number is not a prediction, folks. It's a reflection of current needs, trends, rising premiums, rising drug prices, and the increasing cost of routine care. The concern is that many retirees assume Medicare will function like the employer insurance they had during their working years. No, it doesn't. Medicare has deductibles, co-pays, and coverage gaps that can create sudden financial strain. Dental and vision care are almost entirely out of pocket, unless retirees, you and I, plan for it in separate plans. So one of the things you first question is do I need to purchase a secondary insurance? I did. You need to know this. And long-term care, that is a kicker or a killer. And it includes nursing homes, assisted living, and extended home care services. None of it covered by Medicare. Fidelity's warning is not meant to alarm you, folks. It's meant to prepare you. Retirees need to understand the difference between medical coverage and medical protection. Medicare provides coverage, but protection, the ability to absorb unexpected costs, that requires planning, savings, and awareness. So this morning's takeaway is this. Healthcare emergencies in retirement are not always medical. Sometimes they're financial. And the best defense, is understanding what Medicare does, what it doesn't do, and what steps you need to take now to avoid your crisis later. For anyone listening and relies solely on Medicare, take time to review your coverage. Know your deductibles. Know your out-of-pocket limits. Know what services are not included. And if you're unsure, speak with a trusted advisor who can help you evaluate your options. Awareness today prevents emergencies tomorrow. So to keep aware, keep informed, and be knowledgeable, please go over to pwtrelinews.kinsta, KINSTA.cloud, CLOUD, and we'll see you later, Gators.